Good afternoon. This is Good Afternoon Ghana. My name is Winston Taki. Tonight, this afternoon, I'm sitting in for Annie Ampofo. It's going to be a very interesting afternoon because we'll be touching on some very critical issues from the Aggregate sector. We move to University of Ghana Medical Center that has been opened. The hospital is now officially open to the use of the general public, and also we'll be hitting on the Affirmative Action Bill. There's been positioned that as of now, the Parliament, also women engagement in decision making, we should have at least 30% of women representation across the divide in governance and every sector of the economy. These are more issues we'll be discussing here on Good Afternoon Ghana. We take a break. We'll be right back with more. Welcome back to Good Afternoon Ghana. My name is Winston Taki. You can also be watching us live on our WhatsApp platform, also on our Facebook platform, and also on Twitter. We are trending there as of now. You can tweet at us at Good Afternoon. Whatever you have to share with us, we'll be reading it live on the show. Today, we will be discussing the case of Affirmative Action Bill that for the past 8 years has been in the House of Parliament waiting to be passed. And we'll be having a very interesting conversation to that effect. And from there, we'll be touching on the University of Ghana Medical Center that has been open to the general public, moving on to agri-related business as well. But let's first start with the Affirmative Action Bill. I have with me here in the studio the member of Affirmative Action Bill Coalition and representative of the Abantu Abantu Development here in Ghana, in the person of Kina Likimani. Good afternoon and welcome to Good Afternoon.
Thank you very much. Good afternoon. Thanks for having me.
Great. Can you first of all enlighten us about what the Affirmative Action Bill is all about as of now?
Okay. The Affirmative Action Bill, which has been in development for the past 8 years, you said it was with Parliament, but it's currently with Cabinet. It's gone back to Cabinet.
Great.
It's a tool, a policy to correct the historical lack of or underrepresentation of women in political and governance decision-making bodies. Ghana, back when we had one of our first parliaments, our past president, Kwame Nkrumah, our first president, instituted an affirmative action policy where they would pick one woman representing each of the 10 regions. So affirmative action isn't new to Ghana. We've had other policies that would fit the affirmative action title, like the Northern Scholarship Fund, free education. All of these are affirmative action policies. They are policies meant to right historical wrongs, and it can be in the area of education, it can be in the area of political representation, and that's what this bill is about. It seeks to raise the number of women in governance institutions, in public bodies to 40%, which is, I think, the UN recommended level. Okay. Yes.
So why is this project centered on women, basically?
Yes, very good question. Particularly women in Ghana and across the world have been subjected to historical and contemporary oppression, which curtails their full participation in politics or even in some professions. So here in Ghana, for instance, Ghana is a country of ever-widening inequality gaps, and the poorest are women. I'm sure you are aware of that. And there's a system called patriarchy. I don't want to get too technical, but there's a system called patriarchy that privileges men and a few women. So the affirmative action targets women because currently in Parliament, we have only 14%. Where the UN recommended level is 40% and above. At the district assembly level, we are less than 5%. And for a country of a population that has 50% women, it's very important that all parts of the community, of all parts of our nation are represented adequately in politics and in decision-making and in governance. Otherwise, you are basically trying to develop a country, give people more freedom and justice with one hand tied towards your back. But the reason it also targets women is because if we wait for the culture to change, it will take too long. in all the countries around the world where women, the representation of women is even 30%, it has come about by affirmative action measures. This includes Rwanda. It includes our own sister nation, Senegal, and other places. So this is why we target women.
I'm sure Abantu has a lot of projects that they are working on.
Yes.
But on the affirmative action, what are you currently doing to that effect?
This advocacy campaign to enlighten Ghanaians about the bill and for all of us to collectively push for the passage of the bill is part of an Abantu project that seeks to strengthen women's representation at the district assembly level as we are headed towards the elections, assembly elections next year. The project is funded by AWDF, and we absolutely know, it's not even a feeling, we know that without the passage of the bill coming into effect before the elections, the representation of women at the assembly level after the elections will be as dismal as it's ever been. And we do not want to go through another election cycle, another term of representation at the assembly level, while the bill just needs to be passed.
So should it be passed into law and becomes fully institutionalized, what do you expect to foresee in the foreseeable future?
Well, the bill empowers or requires that public boards, parliament, so basically the political parties will be part of this. A president cannot appoint, members to a public institutions board that is mostly male. We expect that over time, but much faster than without the bill, that the representation of women in these institutions, in these governance bodies, will go up to 40%. So it's sort of adapted particularly by the political parties. That will be up to them, but. Basically, we'll be heading towards 40% representation.
I understand that for 8 years, it's been a tax, a Herculean one to that effect.
Very much so. Yes.
So right now, where are you?
Right now, the bill is at the cabinet level. It was brought to Parliament and sent back. So what we are hoping is that we are calling on Cabinet and the President to approve and send it on back to Parliament, because there is really no reason why representation of women in Ghana in our governance institutions should be so low. It's a blight, really, on our development. When people assess our democracy, it's one of the first things they point out. It's a major risk, and it's not good for us at all.
Currently, at the local level, the representation of women stands at 7%. What does it mean?
Basically, it means that so first of all, issues that directly concern women will not be adequately addressed. And when we say issues that concern women are very much concerned by a wide variety of things. So besides children, education, marketing, markets, trading, farming, security is a big issue of concern for women. Justice. So all of these things, when you do not really have, you can't even imagine what democracy will be like, what representation will be like when you have a section of your population that is so concerned with so many. Unemployment, employment of the youth is a concern to women. We expect that our democracy will be enriched. But then again, as I like to point out, women, we are not utilities. Like, we can't justify our representation based on the good that we will do. You've heard the saying that educate a man and you educate an individual, educate a woman and you educate a community. That's all nice, that people see that women bring good things to the table. But in our own right, as ourselves, as people in a community, as part of this great nation, we need to have a say in what goes on in our development.
Nonetheless, there are some school of thought that also hold that consistently it's been on the case of women demanding for their right. Do they have a valid point on that aspect?
That
women consistently demanding.
But we demand our rights, because if you have a situation where women are demanding their rights, it must be because our rights and our needs are not being met, that we do not have enough freedoms and we do not have access to adequate justice. That is why we demand our rights. So if every year we are demanding rights, then we know that we are failing our women. We are failing them in terms of health. We are failing them in terms of employment. We are certainly failing women in terms of political engagement, in terms of political participation. So if every year, every time we talk, we are talking about more employment, in freedom, in sexual reproductive rights, in being free of sexual harassment. If we are demanding all of these things, then it must be because the country is not meeting its obligations to give women as much. We just want to be free to be our best selves. And we can't be we can't continue to be in this situation where the rights of women, our freedom is curtailed.
In as much as the right is being demanded, how about the responsibility aspect? Because there are instances where when it comes to holding accountable, society says, they are women, then let us become on them on that aspect. What do you say about that?
I don't understand the question.
Basically, society-wise, instances where a man and a woman are doing a certain kind of job, there are instances where men are asked to do the tougher things compared to women. In that aspect.
But I fail to see where any career that a woman cannot perform like a man. I can't see that. Is it the military? Is it the Navy? Is it the Air Force? Is it drilling of oil? What is it that a man can do that a woman cannot do? And it is not only that, even in areas where we've been relegated as this is what you should do, like the softer things, teaching is not a soft career. It's an incredibly difficult and demanding career. Developing children is incredibly difficult. So I can't find any part where it's only the purview of men. Okay. Because in many countries, women go to combat. And I assume that combat is the hardest thing.
That's quite true.
The most dangerous.
Yeah, I'm here with Kina Lekimani, and we'll discuss on cases of affirmative action and also how critical it is for national development as of now. Representation in various annals of governance is necessary with regards to the number of women representation. They're calling for currently over 30% of women across every sector of the economy. We take a break. We'll be right back with more here on Good Afternoon Ghana. Stay tuned. Welcome back to Good Afternoon Ghana live on Metro TV. We're also streaming on our Facebook page at facebook.com/Metro TV. My name is Winston Taki, sitting in for your regular host, Annie Ifua Ampofo. This afternoon, we touched on the Affirmative Action Bill. I spoke with Lekimi, and we touched on the need for having a wide range of women representation across governance and also most boards in the country. But let's just go to what this has become a very topical issue this week in regards to the fuel prices. You can see on your screen shortly how much you'll be buying at the various oil marketing companies when you go there today. There will be a few changes, certainly, with regards to how much you're paying, because some have adjusted their figures as at this afternoon. Currently, the total is selling at, that is for super, 9 cedi 70 pesos, and also diesel selling at 10 cedi 80 pesos. Guel is selling at 8 cedi 22 pesos for super, and also 8 cedi 22 pesos for super as well. And Zen Petroleum is selling at 9 cedi 36 pesos, and for super and diesel for 9 cedi 99 pesos. You could see those prices reflecting that. So when you get there, wherever you've been buying last month, you should know that you need more to purchase fuel at various pumps across the country. You're back here. So we'll still be having the conversation here in studio, but this time around we're moving to the aggregate sector. Consistently, we've had figures, numbers that Ghana, in terms of food security, we are the best position. But we know we fell from 86th position across the world to now 70-something thereabout. But as to whether economically or domestically we have what it takes to sustain our standard of living, the prices of commodities have been going up here and there. If you go to the market, you buy something today, the next day, you'll be shocked how much you need to repay whatever you used to buy suddenly. But here with me in the studio, I have the founder of Wealth, who is Ivan Stere Mensah, with me here in the studio to discuss the case of Ghana's agro-business sector, how thriving it has been, and also what we need to do in order to keep our agri sector revitalized going forward. Good afternoon, Mr. Evans. Welcome to Good Afternoon, Ghana.
Thank you very much.
Great. What will be your assessment of Ghana's agri sector, possibly for the past 2 or 3 years coming down?
Well, thank you. I think that looking at the way COVID hit us 2 years ago, I assume that all was not well, but the agri-food sector has been very, very engaged in a very challenging times. Personally, farmers have really struggled to keep themselves together. And but all in all, I think that Plentiful Food and Job and other government interventions also came in, and I'm sure that personally it has not been easy. And then we see what will happen, and we want to hear what the government had for us. But generally, farmers have not been really in good mood.
Now, let me understand what is Agro-Wealth about?
So Agri-Wealth is about it's a foundation that is geared toward galvanizing and mobilizing the young people of Ghana towards agricultural productivity and action. I believe that if you look at the population of Ghana's structure, okay, the young people are almost about less than 25, under 25 years of age. And these are the strength of the nation. They have energy, they have a lot of vigor, and we can, if we're able to deliberately galvanize their energies towards a positive action, they'll be able to do much for our country. And I think that that is the vision that I have by mobilizing the youth of the country towards this project.
And how is it going so far?
We are starting our first meeting a conference in Kumasi, KNUST, called the Ghana Youth Summit, Agriculture Summit. That is to say, we want to drive the narrative and see how the trends are going in the agri space, and how we can be able to position every youth in creating career and employment in that space, and also to be able to ensure food security going forward. I mean, as you can see, the agri-business sector is facing so many challenges based on the conflict that is happening in Russia and Ukraine. And I can tell you that going forward, it's going to be a very, very serious matter.
Okay, let us stay on the fact that the Ukraine-Russia conflict has, like you said, a rippling effect on our economy. Which aspect of our economy, basically agri, can you pinpoint and say is going to be hit by these actions?
Well, if we look at our agricultural structure, most of our foods are imported. And if you look at wheat, rice, soya beans, and other things. So, and Russia and Ukraine, okay, they control about 30% of the global wheat and grain market. So the conflict that is happening there definitely is going to have a global impact on us. The ripple effect is going to be here in Ghana, you know. So, and it's an opportunity time also for us to also look inward and to generate our own agricultural produce and eat our own food. This is where the opportunity comes for us to rise up to the occasion. And that is why I believe that Agri-Wealth and Ghana Youth Agriculture Summit, okay, has come in time as this to be able to showcase the energies and the strength that we have, that these are the opportunities that are in the system, that as these things are happening, if we can be able to look at the crisis and see opportunities in it, I'm sure that we'll be able to make a positive impact.
Now, as a young man, I want to go into farming. The first question I ask myself is, which aspect of farming should I go? First of all, you always want to assess what you have against what you see as an opportunity. For instance, where should I look? Which opportunities are there in farming? Which area are available for any individual who has no background in agribusiness?
Yeah, so I think that first of all, research and development is important, especially in the age of technology. And I think that we need to have a lot of information in the system. Personally, on the ground, the information that we have are very, very scanty in terms of which are the improved varieties, which produce or crops, okay, sell very well, I mean, in terms of demand and supply. Okay, so the way our agri sector is structured somehow is very problematic. But I think that there's also a way out. And the way out is that this time it presents an opportunity for us to see that every other crop or commodity in Ghana is viable. The opportunities are there. For instance, I do cassava, and I see cassava as one of the greatest commodity that we can industrialize and make Ghana a very big exporter of cassava. You know, because if you look at the derivatives in cassava alone and what it can do, the starch alone, last about 2 years ago, Ghana imported almost about 300 tons of starch. And starch alone, the kind of value that starch gives to our society, it's enormous. So if you're able to crystallize, you know, all the commodities and see the value in it and give information out to the young people that, look, you can go into rice, you can go into maize, you can even go into mechanization, the logistical aspect of it, the value chain. So the opportunities in the Aggregate are enormous, my brother. And that is why I'm doing this campaign, that I will need stakeholders, politicians, government officials, policymakers. Let's sit down. Let's look at the agri sector. Let's look at the challenges that the young men are going through. Why are they not finding agri sector attractive? Why are they? Because we have the policies. We are talking about planting for food and job. We are talking about incentivizing the agriculture sector. Yet the young people, the youth, are not going in.
I'll ask you that same question. Why is it not really conducive, or why is it not attractive to the youth?
It's not attractive to the youth because I think that the way we have, over the years, given the narrative to the agriculture has really made the youth to think that agriculture is for the poor, okay, in quote. But agriculture is not for the poor. It's expensive. We have not been able to present it, okay, from a business perspective. If you see that the agriculture or agribusiness is purely a business, it's a career area, it's a place that we can develop career. Our young people go to school, some want to become doctors. Why? Because they've seen over the years how it has been structured. Some want to become doctors. Can't we also have young people who go to school and say that I'm coming to university, when I finish, I want to become a farmer? Okay, so it is how we present it, how we position it. And I tell you what, now, even now that we are in the age of technology, we can use technology to really improve on our productivity. And I've seen young people, guys using technology, how they can mechanize farms and all that, farmer line, how they can mitigate climate change by drones and data. So we need to have a conversation around agriculture and how the youth can be engaged profitably and open the opportunities for them,
okay,
and try to help them to be able to remove all the bottlenecks.
Right. I did a market survey with regards to maize and beans personally, and I also spoke to the Peasant Farmers Association, the president, and my confirmation, the conclusion that came was that now maize and beans has increased by 70 over 100% in terms of pricing. Initially, that's from last month. It was selling around 350. Now it's over selling above that price on the market. What could be the leading factor? Or what could be the cause? Is it scarcity, or is it because there's a case of hoarding to that effect?
Well, several factors. One is the exchange rate. The other one too is the cost of fuel. You know, because when the fuel is going up, definitely mechanization will go up, okay, which will affect production, which will affect food prices, which will affect logistical services also. So in that sense, the value chain, the linkages, it all affected. But I see that we need to be able to have a conversation and a deliberate and intentional approach to how we organize our farming system. And I think it's starting from here. And I believe that going forward, we'll be able to help to be able to lift up all these limitations away from farming.
You're watching Good Afternoon Ghana here, and the discussion is still ongoing with regards to the farming state. But let me still go back to Mr. Evans. You know, consistently we always wait for the rainy season before we get certain type of food crops in Ghana. For how long are we going to be having that system operationalizing with a country that used to be boasting of greatly tremendous investment or improvement in the agric sector?
The how long is, my brother, is a question all of us should be asking, because I think that we've come a long way. 65 years by now, our agri sector should have been revolutionized. But going forward, we cannot not always dwell on the problem. Let's look at the solution and how we can get there. I think that we need to really mechanize our farming system. I say this to say that we need a lot of government intervention. The government approach should be very, very urgent. And also looking at the way the rains are even happening now, okay, you can see that there's a cause for an alarm that our food, is going to have a problem. So we really have to tackle irrigation. We have to look at how we can be able to have all season harvest. And that is something that we need all the stakeholders to come on board to be able to address that.
Okay. So finally, what is the summit about, and how important is it as of now? Where will it be?
Especially when we are crying about what is going to happen about food and rising cost of food. Okay, that is the point I'm making, that we need to have a conversation how we can organize our youth, okay, and remove all the limitations and get them on board. Okay, we have youth unemployment, and we are touting as a big deal for us. Why can't we find a way of getting our young people, okay, to see agriculture as a career development area where they can build career from there, increase their livelihood, and build income for themselves.
At where?
Yeah, so it's happening at KNU West on the 9th of April on Saturday, and then from there we'll come to Legon on the 23rd of April.
Great. Mr. Evans Shermensa is the founder of Agri-Wealth, and we will discuss in the case of agri-sector how important and critical it is for a nation such as Ghana to prioritize our development going forward. And so we will touch on that. But we'll move to another very interesting discussion that has to do with the University of Ghana Medical Center. My colleague Bright Amani was there and was taken through the facility, which now has been open to the general public, and he spoke with Dr. Darius Osei, who is the CEO of the facility, and there is more on this video. So just enjoy.
Here on the premises of the University of Ghana Medical Center, located at Legon in Accra, Ghana, the first and biggest of its kind in West Africa, and it has 3 different units. The first one being a science research center and also a 1,000-bed clinical facility, and the third one being a training and simulation center, all here as part of the University of Ghana Medical Center here in Accra. And I'll be speaking with the Chief Executive Officer of the facility, Dr. Darius Osei. I am Bright Nanakwesi Amenin. All right, so I'm here with Dr. Darius Osei, who is the CEO for the University of Ghana Medical Center here in Accra. And we want to find out, we've been told that it's fully operating, and now the first phase was integrated, and the second phase, which I've been told it could be said as a shell. Okay, that was the first phase. And the second phase with the operation is now ongoing here. And I've been joined here by the CEO of the medical center, Dr. Darius Osei. Now, when we say fully operational, what do we mean by that?
Well, it means the structure process has all been put in place, and the structure here means the buildings you see were all ready in phase 1, but it was only a brick and mortar. And then phase 2 completed some of the chambers that will make it functional. Apart from that, we were just limited because of the lack of functional beds. We were just operating 100 bed as against the potential 1,000 bed, which means in the beginning we had to scale up gradually. The scope of all the expected services were not ready, and we were limited. The second phase brought a lot of finishing, which made the first phase functional. A lot of meaning in the first phase. The first phase, we were operating the outpatient department and just 100 bed, the ground floors. The second phase completed most of the other floors, which means we needed to employ the required staff, the mix of different professionals, both administrative support services as well as the clinical staffs. So presently, we've managed to have over 800 staff, about 147 doctors, over 400 nurses of different category. Being a quaternary hospital, it means you are looking at specialized clinical staff, that is critical care nurses, midwives, in ICU nurses, and so on and so forth. In a similar fashion, you also need different subspecialists in terms of doctors, right? And so fully functional means that you have also designed the patient care path, being a new facility, not already in operation. It means new people who have been employed into the facility must be trained to have that patient experience and the provided experience as well. And then, these electronic medical records. When you have employed people coming from different parts of the country, you don't just ask them to start working. So the 4 years from 2018 to date means we had to go through all these processes. And again, it was a turnkey project, which means the contractor built and then he equipped and transferred. Now, these are medical gadgets that needed testing. The standard authority needed to pass them. The HEFRA, that is the Health Facility Authority, had to give us accreditation for practicing. The Radiation Authority have to test the radiation levels of all the photo imaging facilities. So you don't just open a hospital and then start. So we have gone through all this process of getting the right authorization, getting the right persons to manage the different areas, and then also tested the patient path in terms of how they get themselves registered, what they are supposed to do, especially in an electronic medical records environment. And so now I can say the 1,000 bed has been fully all functional, and nurses and doctors have been distributed to their various areas. And so we have the laboratories, the photo imaging, and all the other areas functioning. So when we say full operationalization, it means we have gone through all these various scenarios that I have explained to you, talking about the structure itself, which is made up of the materials to work with, the manpower needs, and then the infrastructure itself, functionality, and then the process of work, how to eliminate duplication of services, how to properly train your staff, and then make sure that the outcome of care is realized to meet the objectives of the establishment. And then again, this facility is looking at 3 major areas. We are looking at...
I was going to come to that. Let's start with the 1,000 clinical setting section. Tell me about that.
Yeah, well, if you look at building 2 here.
This is the building 2.
Yeah.
The women and children.
So if you look, we have the consulting rooms, which is the obstetrics, gynecology, and then pediatrics consulting rooms. We also have the obstetrics emergency, and then we have the pediatric emergency, all in this building. Then we have the pediatric ward itself, and then we have the new neonatal intensive care unit, that's the NICU. And we have the pediatric intensive care unit, we have the pediatric surgery unit, And so when you talk about pregnancy in itself, right from the beginning, antenatal through to delivery and postnatal, we can all have them here, as well as all the complications that comes with it. If children needs to be operated, if mothers in the course of pregnancy have some complications. And then very top also we have the artificial reproductive technology, what popularly called IVF.
What do you mean by that? Break it down for me, for the layperson's understanding.
Reproductive technology. That is to do with people who are in need of children, and childbearing becomes a challenge. That is, we popularly use this balance IVF or whatever, right? So that is on the top floor, which is also ready. So all issues concerning making babies, looking after babies and their mothers as well, can be taken care of in this building.
And it has its own full blog.
Yeah, so it's called the Women and Children. That is what it means. And then when you look at one of the branches here, that is the medical training and simulation. It is supposed to be the biggest in the sub-region. Yeah. We train medical students in the past using sick persons as experiment. Can you imagine you are already in distress and then we have thousands of students coming around you to use you to, study. Now, here we have the simulation rooms, the mannequins and so on that students can use. It is also a place to train not only medical professionals, but also people like you, just to know the basic life skills that if somebody fall, all of it. So as I speak to you, State Transport Corporation have a contract. Their drivers, about 50 of them, are coming to be trained so that at least they can get themselves abreast with the basic life saving skills. We have already trained about 200 personnel of the consolidated bank personnel. I mean, accident at workplace, somebody falls, and what do you do? So it has a multifunctional training, and it's not only limited to the government medical students, the private medical schools, as well as institutions, the allied health, and all of them can have access to training themselves.
Pardon me to intercept, but then as you've mentioned two institutions that have already been here for your training. I mean, first the State Transport Corporation and all that. Now, let's talk about money issues here, financial issues. Is it for free?
It's not free because the place must be maintained, mannequins must be replaced. But I mean, there are structured fees that are affordable and reasonable so that we can make training easy as well. So it's not for free. So
this is supposed to be the biggest in West Africa, the Medical Training and Simulation Center, so far the biggest in West Africa. Let's not talk about the third one, which is Science Research Center. Tell me about that.
Yeah, medical research is also important, especially when you are dealing with high-level medical practice. When you are going to do artificial reproductive technology, when you are going to do cardiovascular, genetic medicine, all of it must have some research basis. So what we have done here is to make sure that we have the requisite personnel, the research fellows, which normally are not in the payroll structure of the Ghana Health Service. But we manage with the Fair Wages Commission to convince them and bring in fellows who more or less have their conditions of service, just like the university lecturers. So we have about 5 fellows of research. In this case, grant writing for research will be easier for us. And then so far, we managed to, we became very popular during the COVID period. Yeah. So we managed to get some funding through grant writing for COVID research and so on, because we have a lot of data available which can be very meaningful in terms of research. So these are the 3 major areas: the medical simulation and training, the research, and then the clinical services.
These are all very sweet statements, and hopefully helps Ghanaians and reduce our health problems. But let's now talk about one of Ghana's biggest problems. It's seeing our politicians and our president fly out of the country for medical assistance outside the country. Now, will this facility solve that problem?
Definitely so. I mean, this is the main objective. The facility is supposed to answer the problems of medical tourism. cutting-edge medical care, the subspecialty specialist, services, cardiothoracic, urology. You're talking about gastroenterology. We're talking about all these are very specialized services that already Kwalebu is giving that sort of service already. But I must say that
given, but we still see our
definitely.
presidents and our
we
politicians
are
travel
here
out of the
to
country.
complement. If you have 2 or 3 of the such facilities giving the same service, then definitely access to healthcare is much more improved, because one of the dimensions of quality healthcare is easy access to healthcare. And so if people are queuing now for these kind of highly skilled services, and then we have one more in place to complement, then I'm sure we are going to answer the needs of the people better.
One very interesting point I've also picked up from Ghanaians is that they believe that this place is specially made for a certain type of people. How true is that? And if it's not true, you want to debunk that?
No, it's not true. It is meant for all category of persons who are referred to as to take care of. Healthcare, one of the dimensions of quality healthcare is equity of care. And so it answers that question, definitely.
Another issue to that, there are some hospitals you go and it's either you are referred to by a different hospital or not. This place is just a walk-in. Is that how it works here?
Well, when you talk about specialized care, I've described that, look, if somebody is pregnant, he doesn't need to be referred here. You can walk in and decide that, look, I want to use UGMC and go through my labor and deliver and take. That doesn't need a referral. But if you have a cardiac condition, for instance, definitely it means somebody at the lower levels is seeing you, and what you are saying is that if you are to come to us, let's have some form of referral where your status and conditions are clearly articulated. Then we can continue, definitely. We are not encouraging people with the top 10 conditions like malaria, respiratory tract infection, and others. Unless they are complicated, then they can come to it. But we will encourage that they are seen by their lower levels, and then when it has gone out of hand, then they can actually seek our opinion, so that we can allow the professionals and highly skilled people to focus on these high-level services.
Let's not talk about maintenance. We don't want to wake up one day and realize a department of this hospital is not working. How are we going to ensure that each and every part of this particular community, as you say, it looks like a community, is working effectively as it should be?
Right, definitely. We have not lost sight of the fact that hospital must be maintained. And then as the contractor hands over to us, we've entered into a lot of agreement with the vendors who were the subcontractors for the contractor to continue. But definitely you will need to maintain these facilities with money. So as we scale up, there's going to be a budget line that will take care of the various activities and make sure that the facilities are functioning.
That budget is not ready yet?
Well, that is what we are doing now, and telling people to have access. Definitely there's every activity has a price tag. And so if you are to maintain, you have to generate money to do that maintenance. And then we are aiming at self-sustaining ourselves, which means we should generate enough to be able to take care of the various line items that comes into taking care of patients and then maintaining the facility as well.
How much money do you think we would need to make sure we maintain this facility?
It's premature for me to we have to get our benchmark figures, at least when we enter into these agreements. They are planned preventive as well as corrective maintenance. Planned preventive is the structured one where whether the thing is working or not, people come to see and then advise what to do. And corrective measures, we don't have control over it. You wake up one morning and then all the lights are off. So you cannot put a figure to it. But as much as possible, by a certain time, we should have an idea that, look, you need this amount of money, both for corrective and then preventive maintenance.
Thank you so much. Anything you want to tell Ghanaians aside what we discussed?
Not much, just that we are all excited that it has taken a lot of effort. I want to thank all the managers of this facility for exercising a lot of patience because, most people were in a hurry, but it is healthcare. And once you're going to work on human beings, then you must understand what goes into it in terms of structure, process, and then expected outcome. Now we are sure that we've been able to place ourselves in that position where our structure, in terms of manpower needs, in terms of materials to work with, it's good enough for us to take off. And we have also simulated a lot of the processes in terms of patient care path, our experience, and then identify most of the gaps. There are challenges that we continuously have to work on, though, but I'm sure we cannot wait forever for us to be perfect human institutions, but continuously we'll continue working towards making sure that the facility is functioning. But from what we see and what we have assessed, we can confidently say that, look, the facility is ready and we are here to complement the tertiary institutions, and then we will decongest the queue and then also improve upon the no bed syndrome.
All right, thank you so much. So Dr. Darius is the CEO of the Legon Ghana Medical Service in Accra.
That was my colleague, Bright Amani, with the interview there. We'll bring you more on the development at the facility. It's now open to the general public. So if we need a better health facility to usually do a checkup, University of Ghana Medical Center is now officially available to you. We had discussion on Aggregate. We touched on affirmative action. Good afternoon, Ghana, today. And I'm most grateful for you making time to watch us today. My name is Winston Taki.